Welcome to Stronger at Home. If you are thinking about starting with strength for the first time, awesome. Intention is the first and necessary step towards participation, but I know it also helps to know what to expect. Strength training is safe and effective for all ages and all abilities. Most importantly, you do not have to be strong to start. The UK Chief Medical Officers and World Health Organization's physical activity guidelines both recommend all adults over the age of 18 build their strength on at least 2 days per week, even for those living with chronic health conditions. The benefits of participation far outweigh the risks, but we know that's not how everyone feels. There are more risks in being sedentary and having low levels of strength than there are from being strong. However, if you are still unsure, please speak to your healthcare provider. In the meanwhile, here's what you can expect when starting a strength training program. Heart rate. Your heart rate will respond to strength training in a way that ensures your blood, oxygen, and nutrients are being delivered to the working muscles. Heart rate will increase, and this will continue to increase with increasing intensity, effort, and duration. This is normal and temporary. When you stop exercise, you will see a decrease in your heart rate. Over time, and with consistent strength training, you may even find that your resting heart rate is lower than before. Blood pressure. Your blood pressure will also increase in response to strength exercise, and it will continue to rise with effort. Sets with more repetitions will likely produce a higher blood pressure. As with heart rate, your blood pressure falls very quickly after you stop exercise. Blood pressure values might even fall below normal for several hours following your strength training session. Over time, and with consistent strength training, you may even find that your resting blood pressure is lower than before. Breathing. You will breathe more frequently and inhale and exhale more air when starting to exercise. The sensation of difficulty breathing can occur in healthy individuals when participating in heavy or intense exercise. This sensation can also occur in people with poor fitness levels during less intense exercise. If anticipating the increase of your breathing rate is worrisome, start with lower intensity, shorter sets, and progress more slowly. Take extra time between sets as needed. With strength training, there is no need to rush your rest intervals. It's more important that you rest as long as you need and come back when you feel refreshed. This rest interval can even be up to 5 minutes between each set. The great thing about strength training is that effort is not continuous throughout a strength training session. In fact, it involves a lot more rest than most people expect. In strength training, you'll likely work hard for about 30 seconds and then take a 1 to 5 minute break. Many people enjoy this aspect of strength training, especially if you are new to exercise and you don't quite like the feeling of continuous effort. Soreness. Soreness with new exercise is temporary and normal. This does not represent harmful tissue damage. The newer you are to exercise, the more likely you will experience some soreness. The soreness may be immediate, but it's often delayed and peaks a day or two after your session. Soreness will subside with each training session. That is, the soreness you experience will become less and less noticeable after each strength training session. This is called the repeated bout effect, and it's protective against future strength training sessions. Within a few sessions, you won't feel sore at all. This soreness may return again when you start a new training program with new movement patterns. If you are worried about feeling sore, start at a lower intensity and progress slowly. Fatigue. If you're new to exercise, you might feel temporary and a normal increase in fatigue by the end of your session. Over time, you may notice that strength training actually increases your energy. If you are still worried about strength training, it may help to think of all the things that you're doing already that are very similar to strength exercises. The squat exercise is simply getting in and out of your chair. You may push heavy doors, lift suitcases over your head, and pick children up off the floor. These all mirror strength exercises such as the push-up, the overhead press, and the deadlift. Again, if you're worried about starting strength training, it may help to talk to your healthcare professional. And look for a qualified exercise professional in your area. If you do decide to start a strength training program and notice a dramatic increase in breathlessness, new or worsening chest pain, irregular heartbeats, dizziness, changes in vision, or other such worrisome symptoms, stop and seek medical attention.